Hello, here we are, reflection number 4. I'm sitting here laughing because I was thinking that I'm finally getting a good system going. I'm finally getting my schedule in order. I'm getting going. I know what I need to do, when I need to do it, got my assignments and everything, and then the weather hit. This Arctic thing happened to us. So now, it's kind of thrown us for a little bit of a loop, but as you know, we are a very resilient class. I think that we should call ourselves the resilient class of 2021. We are definitely relentless. And I think that this week has been a really great week. We got to do lab both days. We got to do NDT true facilitation on Monday's lab, which was just phenomenal because, we hadn't, been able to kind of play with each other and move each other around. Um, and then we got to watch and learn how to do the differences between lymphedema, swelling, and edema, which I didn't even realize lymphedema and edema were two different things, but now I know that they are. So that was really cool. It was a really great week. I think I learned a lot. It's all kind of still sinking in, of course. Everything that I learned, I try to just kind of let it come over me and try to really reflect on it as I'm going and thinking about how it's going to affect me. And once I'm out there in the real world and once we get to graduate and all that good stuff. um, some of the things that I think I did well in this lab is I'm starting to really focus on what my skill is when I'm doing things. I'm trying to realize that, you know, as I learned last week, our medium is just our medium, but I need to figure out what am I bringing to the table? What am I doing that someone else is not able to do? And I definitely think that true NDT facilitation is something that is a skill and that I can bring to the table and do it. I would love to learn more about it and get certified both and take some continuing education courses in NDT and also in lymphedema, because I think it's something that I would definitely use in my practice, both of them, and it would just make me a stronger, practitioner. I would love to learn more about that. Um, I learned, true facilitation, and I was able to really do the eversion and dorsiflexion and just kind of help the tendon behind Sam's knee. And it was true. I mean, it really lifted her knee. And before we were doing it, we weren't doing it right. We were doing the eversion and the dorsiflexion, but we weren't, doing it with forceful enough to where it was kind of bringing that knee up. So it was really cool to kind of learn that this week. It was really, really interesting. Um, I had a kind of an aha moment this week, and maybe I'm like super late to the dance, but it doesn't, I mean, it was just so cool to see that when we're setting up prep tasks for a patient, we're preparing those patients for the activity or the occupation. I know that. I understand that a long time ago. But what I didn't put together until this week for some reason, I guess Miss Anderson spelled it out for us, was that if you want to prepare somebody for example, eating, um, holding onto a spoon, bringing that spoon to their mouth, the occupation of self-feeding, then you want to do prep tasks that have the patient working on those motions, like the finger flexors and doing things like bringing a marbles to their mouth. It was just like a spoon with marbles to their mouth, digging in for that spoon and bringing it towards their mouth. It was just like an aha moment, and it kind of was super like enlightening for me. And I was like, oh my God, I totally get it. I see why the prep test would be so important, um, to do, but you want to kind of try to incorporate it into what you're going to be working on next with the patient. So that was really, really, really cool to see. One thing that I know that I need to do better, back in the summer when I was working with Miss Shaw, something really kind of just got stuck in my head. And I remember her saying to the whole class, not just to me, but we need to learn. the muscles of the body, and we need to learn what those muscles do and what they are intended for. Because if we're facilitating, for example, movement patterns with NDT, you need to know what muscles you've got your fingers on, where the point of control is. You need to learn the name of those muscles, and I definitely don't have that down. I mean, I have, just enough to get by, but I think that I haven't, I'm definitely not there, and I need to work on that. Just really going over my anatomy again, and trying to see if that can, stick, especially the anatomy of the upper body, because that's, where our focus is at. But just getting to know those names and figuring out, once again, the name of the muscle, what it does, the line of pull, what, how that affects me in my practice, because I don't want somebody working on me who doesn't even know the name of the muscle or what it does. Which now I know the latissimus dorsi, which I knew this does scapular elevation depression. So that was another aha moment for me. It just brought back what Miss Shaw had already told us once before, that we need to know that stuff. I can definitely see myself using everything that we're learning, the vestibular amount of information that we're getting, as far as how we can get people to work on that vestibular system by moving their head left to right, bringing things down on the floor so that they need to pick it up safely while in the shower or in the bathroom. Definitely is something that I'm just absorbing it, and I'm just getting more and more, just loving it. I just love vestibular work. Um, I just, like I said, I want to definitely get certified in both lymphedema wrapping and NDT training, get some more NDT training, because I would love to be able to bring that skill to my patients. Um, I want to make a video. I'm not sure if I have a willing participant, but I think that's coming next. So yeah, I mean, I think I'm just really starting to get to the point where I'm starting to see what are you bringing to the table, Brenda? What is your skill? What makes you an occupational therapy practitioner? And understanding what that means, because now it feels very real that we're going to work with real patients, very very close to it. So I think it's getting very real for me. Um, Also, something that really helped me this week was, once again, working with someone who does not have attention. Making sure that we're providing those cues so that they can attend, because that's what we're doing. We're working on attention. They don't have it, so you know, we need to do that for them. Keeping those verbal cues, those instructions very short and to the point. That was something that I just remembered that really just kind of stayed in my head when working on attention with someone who's had a stroke, you know. Um, and so I definitely want to do a video. Hopefully, I can get that submitted as well. But for now, I will sign off, and I hope next week is I don't know, it's not looking so good, but I'm sure we'll do stuff online. So I'm looking forward to that. All right. Well, I'll see you next week. Thank you.